Summer is almost here, and no one wants to be in pain while enjoying their summer activities and vacations. Dr. Cecil Graham, Medical Director at Catalyst Pain Solutions, is here with tips for staying pain-free. Good morning, Doctor. Great to see you.
Hi, Suzanne. It's good to be here.
A lot of people have long-anticipated vacations coming up. What can they do before they even leave to make sure that they're pain-free and they enjoy their physical activity?
Well, everyone comes to the table with a different degree of physical ability and all that, but you've always heard stretch. You know, we say stretch. All my pain patients, my spine patients, if you stretch a little bit before you start an activity and do it after, that's number one.
So many of us are going to be taking planes, trains, automobiles, long rides. What is the pain issue? What happens a lot of times to cause that pain, and what can people do?
Well, for instance, when you're sitting,
yes,
you're loading your spine, so you're loading your hip joints. You're also loading all the facet joints, the tiny little joints that align your spine. And they are fluid filled, so they have their synovial fluid in those. When you sit and you load them, it's like squeezing a sponge. Over time, the moisture leaves. And then everyone's experienced, you sit for a while, and then when you go from sitting to standing, it's like, oh my God,
yes,
you know, that transition to move. And that's just getting everything moving again. So that's that initial transition. But on planes or anything like that, in an airport, just a couple of minutes of stretching, getting everything range of motion and stretching, that's still number one.
For people with lower back pain, joint pain, how can Catalyst help them?
Well, we're a basic medical practice. We always go from history and physical. If your problems had a previous diagnosis, good. We always want to get to the bottom of it. So if we have to order MRIs, CT scans, whatever we need to do to get to the bottom of the issue.
I think a lot of people are thinking to themselves, I have pain issues, but if I go, maybe I'll be taken out of commission. I'll have to go to a lot of rehab. What would you tell them?
Well, again, everyone's different, but most everything we do is to try to get people moving. So if you can decrease the pain and do it at the source rather than throw narcotics at you know, and your perception of pain at the brain level, we go to where the pain is originating. So as far as rehab, we always want people to stretch, range of motion, and exercise in conjunction with it, because they go literally hand in hand.
Before people head out and they do that physical activity that maybe they're not in shape for, what do you want them to remember from today?
Well, yeah, it's always the key is stretch. Like you go to the gym, you sit there, you sit and you watch people come in the door. How many people just go right to the machines or the weights versus going over and spend 5 minutes on the mat before they start? People just don't do it, and it's a big, big mistake.
And you treat so many conditions for people. Tell me about some of them.
Everything. I mean, we're, you know, a physician-based practice. We do everything from headaches, spine is our specialty, and knees and hips. We do a lot of regenerative medicine now. So we're a full-service interventional pain clinic.
And I love it, what you said is, and it's so key, and I never think about it, stretch before and after, because you think it's going to be easy, and you're like, oh, I don't need to stretch, but you'll save yourself a lot of pain in the end.
Right.
Doctor,
absolutely.
Thank you so much. We appreciate you coming in for all your great tips. And if you want more information on Catalyst Pain Solutions, visit their website, catalystpainsolutions.com, or call the number you see right there on your screen.